Doctors specialising in type 1 diabetes say they're increasingly concerned about the mental health impact that managing the disease has on patients, especially young women. Diabetes UK estimates up to 40% of young women aged 15 to 35 with type 1 will suffer from an associated eating disorder at some point. Now, NHS England has developed 2 pilot schemes to try to understand the problems, as our correspondent Jeremy Cook explains in this report, some of which was filmed before the coronavirus pandemic.
When you're hypo, all you want is sugar. It's like when you're drowning and you only can think about air.
Living with type 1 diabetes. A year in the life of Naomi. A year of fear and uncertainty. Even before the COVID crisis, things were tough.
I get really shaky and hot and my heart beats fast.
Her body can't make the insulin that we all need.
Injection number 7 today.
To control blood sugar. And so there's a lifelong, constant cycle.
Check my...
of testing.
Blood.
And injecting. And worrying.
Whoa. 2.8.
It's a full-time job that you can't quit. A massive burden that you didn't ask for, didn't expect.
Naomi's consultant, Dr. Helen Partridge, is dedicated to treating diabetes.
Are you doing your insulin yourself?
She knows that most of her patients cope with the demands of type 1, but that it is hard.
You've got to learn to live with it day in, day out. It's not going away, unfortunately. And so actually the psychological aspect is huge.
It means many patients with type 1 at some point experience mental health problems.
I hated it. I hated diabetes.
Eddie is okay now, but as a teenager and type 1 patient, he suffered burnout. That's when the burden of it all becomes overwhelming. He stopped taking his insulin.
I just wanted to be normal. I just wanted to be like my mates. I just thought, I'm invincible, I can get through this, nothing's going to affect me. I started getting problems with my eyes, and I had problems with my feet, and then I had problems with my stomach.
Naomi is 33 now. She was admitted to an eating disorders unit.
I was in the inpatient ward for about 7 months.
She didn't have anorexia like the other patients here, and while they struggled to eat, Naomi struggled to take her insulin.
I just couldn't handle the physical or mental demands of diabetes anymore.
For the first time, Naomi was treated for both her diabetes and her burnout at the same time. A groundbreaking, joined-up approach.
You hadn't been taking your insulin for a long time.
Diabetes patients treated by psychiatrists.
These people are seriously unwell, and they're putting themselves at harm every day of their lives if they don't take the insulin. They could die.
What has this place done for you?
Saved my life.
Seriously?
Yeah. I really honestly think I would have died if I hadn't come in here. I couldn't do it anymore.
Down to the floor.
The physical risks of type 1 diabetes to eyesight and limbs and mobility are well known.
Move over to your other eye.
But this NHS pilot scheme explores the mental health link too.
We want to look at where we are with physical and mental health, putting it together, trying out different ways to tackle it. It shows our team's belief that if we do tackle these two together, it will help improve outcomes.
For Naomi and others living with type 1, the demands can feel too much, and the COVID crisis has piled on the pressure.
Today's a really hard day. I'm sick and tired of numbers and thinking about diabetes all the time.
The team at the hospital are constantly remotely monitoring Naomi, and they know she's struggling.
They've called me in because, well, I think because I just haven't been taking care of my diabetes and I've been hit with burnout pretty bad.
Researchers found that this specialist, joined-up, detailed help is essential for patients like Naomi.
Whether or not there's a cure, I don't know, but even if there's never a cure, there's still hope. There's always hope, and we get to choose life every day, see it as an opportunity to choose life.
Jeremy Cook, BBC News, Bournemouth.
And for details of organisations in the UK which offer advice and support with diabetes, go online to bbc.co.uk/actionline.